The party tendered 18,000 blood ballot papers at the tribunal to prove its case. The session will resume on July 3rd for All Progressives Congress and Independent National Electoral Commission to open their defense. And now moving to other stories, as part of efforts to promote community health care in communities of Kaduna State towards enhancing quality of life post-COVID pandemic, the Community-Based Resilience and Sustainable System for Health is a COVID-19 response mechanism implemented in Kaduna State through NACA and is sponsored by Global Fund. Speaking to newsmen during a roundtable in biannual meeting with stakeholders and media, the State Program Officer Peter Ezekiel says there was need to involve community leaders to advance their cause through helping government efforts to improve quality health care delivery. Community engagement is widely recognized as a cornerstone of public health program to achieve universal health coverage. But what community engagement entails and whether it's robustly implemented are what matters. Here, community engagement and stakeholders have shared some of their success stories in communities through collaborating with other stakeholders in the identification, planning, design and delivery of health services to tackle health-related matters and promote well-being.
The area we want the media to actually come in is to make sure that they resound these efforts that the CBOs and the community people are doing to advance their community health system. Because as we all know, health system not built to capacity pose serious challenge if there is any eventuality of a pandemic. So just as we have the COVID hits, we wouldn't want that to repeat itself where we need to go on our lockdown and then some people will go out of jobs. So what we are actually out to do in this project is to make sure that the community people do what they really need to do to address their challenges.
Our communities have exhibited buy-in. We have taken ownership of this project. And we know that when this is ended and they are no longer here, we can sustain what they have taught us. Now, you see people in communities who are willing to commit their resources in acquiring equipment, refurbishing facilities.
Some of the success stories here is a CLM team. It's a project that we make the community sensitize them to take ownership of the responsibility that the government is supposed to do, and the government cannot do everything. So we educate them, sensitize them, inform them, guide them how to advocate for help. This is one of the major success stories.
I would like to call the community to take action, to take ownership of what this program has been done to them, so that the community will be free from any kind of diseases, infection, and any challenge pertaining healthcare activities.
We started in Wansariki, we moved to Angwanribi, and Meburuji we are in now. So some of the success stories we have got from them is that when we entered Angwansariki, we had their windows, there were no protectors, and the doors, and the entrance door. So we got some community people, in fact the community leaders, they got the protectors and we fixed it.